Hi, I'm Dr. Michael Ford. I'm an endodontist in Harker Heights, Texas. As an endodontist, my specialty is root canals and root canal related problems. Last video we talked about root canals and why we need to do root canals. Today let's talk about why a root canal can get reinfected, why giving the tooth a second chance can be an important thing. Much better than having to have an implant placed or a tooth extracted. There are ways and opportunities to redo a root canal. Let's talk about that. Last time we went over all the little tooth pictures and we described what a root canal was all about and how the tooth gets infected, it becomes sore and inflamed, abscesses can form, and bone gets eaten away around the bottom. So we do the root canal by putting the root filling material in and sealing it up. Now that can get reinfected, even after it's all covered and protected with a crown. Sometimes there's difficulty with the seal. This can allow bacteria back and forth this way. Sometimes there's decay or leakage underneath your crown that puts bacteria in from the top. Sometimes there are extra little canals that'll hide inside the tooth. These little extra canals we can generally find by using the CBCT. That is a three-dimensional X-ray picture of your tooth. You're familiar with the CT. The CBCT is the same idea, only we're only looking at your teeth. Sometimes, though, things are cleaned out with the best way they could be given the current technology, but as we discussed, there can be a lot of debris that's left inside your tooth with a conventional root canal. When any of these things happen, your root canal becomes reinfected. Well, that basically takes us right back to our very beginning picture again, only instead of your infection being in the pulp, now it's actually in the root filling material. When that happens, you will not ever get hot or cold sensitivity. So if you have hot or cold sensitivity, it's not the root canal tooth. It's another live tooth. With the reinfection, no hot or cold sensitivity, but you do get all the rest of the things. You can get a tenderness to biting pressure, abscesses forming, bone being eaten away. With this or the conventional reinfection, this can eat away so much bone, it eats away at the bone, at the gum, and makes a little gum boil or gum pimple out here on the outside. Not a normal thing, not a sinus infection. This is a root canal infection. So what do we do? Well, again, antibiotics would artificially suppress these symptoms, but it would never address the root cause of your problem. So to do that, we get in and clean out this old root canal filling material. To do that, we make an opening in the top part of your tooth. That's sometimes through a crown, most of the time through a crown. Sometimes a natural tooth is still there. And then we take out the old root filling material. Again, this is just simply removing the old root filling material. With a conventional redo of your root canal, we'd have to take away a lot more of the inside of your tooth. We'd have to put medicine in there. It could take 2 or 3 visits at 1-month intervals, but not with the gentle wave. The gentle wave has made a huge difference in the way we're able to do and to retreat these teeth. The gentle wave process, recall, power washes and power cleans the inside of your tooth 5 different times. A distilled water rinse, a disinfecting rinse, a distilled water rinse, a cleaning rinse, another distilled water rinse. Lots and lots of cleaning, pulling all the old debris and things out of the inside of your tooth. Once it's clean like that, it is cleaner than it can be even with multiple visits. So cleaning out the inside all the way down to the bottom. Then from there, we place a new root filling material down inside your tooth. Once that's completed, again, same thing, permanent filling, sometimes stabilizing it with a post, and then a crown over top your tooth. Now, lots of times, if your tooth already has a crown, I can just place a filling right back in on the top part of your crown and seal it back up. Should, however, we find decay up underneath of your crown, or your crown cracks, breaks, fractures, or comes off your tooth, well, then your crown would have to be redone by your general dentist. Most of the time, it's just fine, though. The area where the infection is at the bottom, depending on the size and position and severity, sometimes that just never heals back in with a conventional root canal. With the gentle wave, some of these bone losses will grow back in within about 6 to 8 months. We see that bone growing back in. Now, sometimes there are things that are just even too big for the gentle wave to handle, because these little things actually, instead of just being a reaction to the infection that will heal up fine, makes us all happy, of course. Sometimes it's actually a cyst. Well, a cyst is not such a great thing. It can get bigger and bigger. And sometimes, like a skin cyst or skin boil, It needs to be removed, surgically removed from the bottom of the root of your tooth. Oh, that sounds real gruesome. Not as medieval as it sounds. It's about like getting a hot food burn to get in there and clean that stuff out. But that's pretty rare to have to do, and even rarer we're finding with the gentle wave procedure. So that's redoing your root canal and giving your tooth a second chance. Appreciate your time. If you have any questions, please give us a call. We're in Harker Heights, Texas. Our number is 254-554-3636. You can also check us out on the web at gentlewavetexas.com. That's gentlewavetexas.com. And we'll be glad to answer any of your questions. Thank you so much.